Today we are performing a carotid endarterectomy. This open surgical procedure treats carotid artery disease by removing plaque buildup from the carotid arteries, the main blood vessels that supply blood and oxygen to the brain, face, and neck. When plaque builds up in these arteries, it can narrow them, reducing blood flow to the brain and increasing the risk of stroke. Our patient today is Rodney Adson, a 64-year-old male. Due to his poor diet along with high cholesterol, his doctor performed CT angiography to check blood flow through his arteries. As a result, he was diagnosed with severe stenosis of his right internal carotid artery. This diagnosis led to the recommendation that our patient undergo a carotid endarterectomy. The following is our demonstration of the case from start to finish.
No holes, no strikers.
Oh, yeah. Dad told me to not panic. I'm panicking.
I'm gonna need some gloves. Gotta wash.
It's gonna start today. Right. We can't have it certification. Only have it on file. And you let it, realize it's gonna be on you for the ER.
Am I okay to do my psych? 50 questions, I just don't open it. My psychology return?
And I'll talk to you individually about where it's at. You guys can plan your life.
So we can what?
Plan your life.
You know what I do need to know
Your life
as
plan.
soon as possible would be because of the fact of my work scheduling, because I'm probably gonna have to let them know about the changes in me doing. I also need to know, okay, I was also needing to know what day would be the day that, do you guys know yet what day we'll be here for that half day? Yeah.
Okay, instruments real quick. Indicator strip. No holes, no strike through. This thing is very large. You can start opening stuff if you like.
What, it's gonna be on Tuesday, like it's up last night, so effective today, what does this mean? So that's the actual,
Yeah, it's the expiration date, so previously in, normally they send you some
oh wait, there it is, so it terminates on, is that?
Yeah, April,
that's on third?
that's in April, after
So that
December.
covers me my whole time, alright,
Sauce plate.
no,
When you're ready.
And it just covers basic stuff, I'm not sure it's.
Another one.
There's no microphone.
Give me 1 second on that one.
select campus, is that talking about
Yep.
Fort Charlotte,
Fort Charlotte, yeah.
insured category? Oops, I didn't mean to do that. Domestic revenue?
No, it's an, we're undergraduate, we're not graduates like masters.
Domestic undergraduate,
Or, yeah, it's an undergraduate. Yeah.
okay, domestic undergraduate.
Graduate would be like a doctor, a master's.
Okay, this is the back table setup.
Laps.
1, 2, 3, 4, 5 laps.
Retex.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10 Ritex.
Ties.
1, 2 ties. Oh, just kidding. 1, 2, 3, 4, 5 ties.
Needles.
Needles. 1, 2, 3, 4, 5, 6, 7 needles.
Blades.
1, 2, 3 blades.
Hypo.
1, 2, 3, 4 hypos.
Bovie.
1 bovie.
Red Robinson.
1, 2 pieces.
Suture booties.
You have 1, 2, 3, 4, 5 suture booties.
Clip pliers.
1 clip applier.
And bulldogs.
1, 2 bulldogs.
Okay.
This is the heparin saline. It is used to flush the arterial artery and lumen. This is the lidocaine with epi. This is the Rommel tourniquet hook. It's used to tighten purse string sutures as well as work as a hemostat to control blood flow. These are a red Robinson catheter and is used with the Rommel tourniquet hook to encircle vessels and maneuver them without causing any damage. This is the umbilical tape. It is used to secure small structures in blood vessels without damage. This is the Satinsky vena cava clamp and is used to clamp blood vessels to control blood flow and prevent blood loss. This is the Cooley clamp and is used to occlude both sides of an artery to excise obstructions without hemorrhage risks. This is the hemoclip applier and is used with ligating clips to control bleeding. This is a mosquito with suture booties. Suture booties are used to prevent the suture line from being damaged and are usually loaded onto a mosquito. These are wheat lanners and they are used to retract the skin for further exposure to the surgical site. This is a right angle with a tie. These are Podsmith scissors and are used to extend the incision. This is the number 11 blade with the number 7 knife handle and is used to make the initial incision into the common carotid artery. This is the Javid carotid artery clamp and is used to secure the Javid shunt in the carotid artery when diverting the blood flow from the operative site. This is the Freer elevator and is used to create a dissection plane between the plaque and the lumen wall. These are Gerald tissue forceps and they're used to handle delicate tissue.
When preparing for a carotid endarterectomy, the patient is positioned lying on their back with their neck stretched backwards. The head is then turned 15 to 20 degrees away from the side of the issue, exposing the neck area more effectively. To further expose the surgical site, folded towels will be placed under the shoulders to give more access to the surgical site.
Okay, so the incision, the landmarks are the earlobe, behind the earlobe, and the collarbone. It's in the collarbones right here. So it's going to be along the sternocleidomastoid muscle is where the incision is going to be. We're going to prep the incision site with ChloraPrep on the neck, being mindful of minimal pressure to avoid any dislodging of any plaque.
The first step in draping the patient is the down sheet. This is used as an extra layer of protection. Next, you would square off the surgical site. Next step would be to ioband the surgical site. Next, we're going to use a thyroid drape to drape over the entire patient. You would pass it to your partner who's draping with you. Completely unfold it. Let it drop. And you would pass on to anesthesia.
So I'm the anesthesiologist in this case, and basically what the anesthesiologist does is we're here to maintain and protect the heart and brain from any ischemic events. So I'm going to be sitting, anesthesiologist sits at the patient's head. So first we're going to connect the oxygen tubing to this endotracheal tube right here. That way the patient gets efficient oxygen flow. And then we're going to talk about the anesthesia. So anesthesia is different with every patient. It's surgeon's preference and anesthesiologist's preference. It all depends on monitoring, the operating conditions, neurological conditions, and hemodynamics. So today for this case, we're going to be using propofol. So you would connect your anesthesia to this little tube right here. And then you would push your anesthesia in. Depending on the patient, that depends on how the dose is, depending on their weight and age. So this machine right here is how we're gonna look at their oxygen stats, and basically this is the machine that I have to look at to monitor them.
We're ready for a timeout?
All right, today we have Rodney Adson. We're doing a carotid endarterectomy today. The time is 12 o'clock. There is no known allergies. We already gave 2 grams of Ansef for the antibiotic. We do have lidocaine on the field. The fire risk is at a 3. Anything else? No. Okay.
Now that we are coming to an end of our case preparation and getting ready to perform a carotid endarterectomy, we need to ensure all boxes are checked and safety is included. Final checks on some components to remember is to have your Mayo stand set up to where we as surgical technologists can anticipate what the surgeon needs. Another is recognizing all the what ifs in a procedure that comes with a timeout. As you can see how everything has come together, you can spot some key steps into performing a carotid endarterectomy. One being to ensure that your Robinson catheter is cut to be used on the Rommel tourniquet, as no surgeon wants to take time for that. Your Javid shunts are lined up, so when asked for a size and the correct one is handed. Your vessel loops are ready to go, and most importantly, you're prepared for that first move. To recap why we are performing this procedure is to remove the buildup of plaque in your carotid artery may be done if the artery narrows by more than 70%. This surgery is very important to help reduce the risk of stroke. Thank you all for watching us. Student surgical technologists help prepare you for a carotid endarterectomy surgery. Please ask any questions you may have and let us know what you think.
Yeah.